The Medicare Access and CHIP Reauthorization Act, or MACRA, is our new reality no matter what happens in November. ACOG worked closely with the AMA, the Federation of Medicine, and the U.S. Congress in getting MACRA passed into law. And Congress wrote the law to ensure that physicians would be integrally involved in determining the specifics of implementation. This aspect of the legislation, as many others, is an opportunity, but also a challenge. The Centers for Medicare and Medicaid Services issued a large set of proposed implementation rules in April, with a proposed starting date of January 1st of 2017. We believe that start date will be delayed, and we are trying to make sure that practices will not need to incorporate changes before July 1st of 2017, giving us all time to prepare. Surveys show that fewer than 25% of physicians are even aware that this new change is upon us. ACOG is here to help you get in the game, starting now. We recognize that our responsibility to our fellows is to educate you on MACRA, enable you to make wise choices in participating in the program, and work with you and CMS to help ensure proper implementation of the law. CMS will not release their final rule until November of 2016, so do expect some variations. Getting in the game means, first, get ready. ACOG estimates that 50% of OBGYNs will not have to participate in MACRA. Educate yourself on what changes, if any, you need to make to succeed and thrive under MACRA for your Medicare patients. Second, learn about the new payment system. MACRA intends to incentivize the delivery of value-based care. It will incorporate quality and resource use measures, certified electronic health record use, and quality improvement activities into a formula that impacts payment. There's a lot to learn, so start now by going to www.acog.org/MACRA. Third, advocate for needed changes. MACRA, like every system, program, or entity we've ever come across, is far from perfect. Many changes need to be made to make it work right. Fourth, work together. We'll help each other rise to this new challenge. We'll all need to embrace this change and work for the best possible outcome. ACOG is already working with CMS and Congress to ensure that the final requirements don't impinge on our ability to deliver high-quality care. We are advocating for changes that will help OBGYNs who have a low volume of Medicare patients. We are advocating for improvements that will simplify implementation and ensure that we can all have trust in this new payment system. We want to make sure you have the time and resources you need to transition to this new program. Our work is being led by Dr. Mark DeFrancesco, ACOG's immediate past president, as well as members of ACOG's Payment Transition Work Group. Dr. Tina Grote chairs the work group, and Drs. Jim Breeden, Steve Fleischman, Scott Fowler, Scott Hayworth, Lisa Ollier, John Keats, Janet McCauley, Jordan Pritzker, Holly Puritz, and Marty Tucker are all actively engaged in helping us respond to MACRA. Over the next few months, ACOG will help you with this important transition with a dedicated web page, ready-to-use PowerPoints, payment reform modules during coding workshops, presentations at ACOG's CLC and annual meeting, on-demand webinars, and weekly call-in office hours where you can talk to ACOG experts about your questions. ACOG is 100% committed to helping you through this payment transition by pushing for the best implementation we can get and to help make this transition as easy and successful as possible for you. We will use every tool we have to make sure you understand this complicated system and can make the right choices for your practice and patients. Please send us your questions and concerns. We are here to help you.